Spoken differently, 25% of the mortality that we've seen in the county since March of 2020 has come in the last 8 weeks. And I fear that with current hospitalizations, there are going to be more deaths. And I want to emphasize that each one of these people has a family who is grieving right now. In my work as an ER physician, I see this day in and day out. Patients are isolated from their families because of the infection control restrictions. Patients who sadly die without their loved ones present. These daily scenarios are heart-wrenching. And I walked into the ICU on Sunday to discuss a critical case with an intensivist. And there were the intubated COVID patients, all in their isolation rooms with nurses present caring for them. It's heartbreaking to see so many people on vents fighting for their lives, suffering without their loved ones. I think so oftentimes we see numbers, but we don't really put the numbers with what is actually happening to people. To the nurses, doctors, and frontline personnel who are working hard every day, I say thank you. And to those families who went through this or are going through this today, you have my deepest sympathy. 90% of the patients who died were not vaccinated and thus represent deaths that were preventable. And although we have given hundreds of vaccines in the past 8 weeks, we still need to see that line keep going up and get those 18,500 people vaccinated. We can vaccinate our way out of this pandemic, and it really is the only path that we have. So I know that many who are listening to this presentation are not vaccinated and not really interested in getting vaccinated. And it is to you that I address my comments today. I think it takes us all working together to get through this. I believe we can all agree on some basic goals of how to control this pandemic. I think we all wish to save as many lives as possible while suffering the smallest amount of morbidity. And we all wish to prevent the overrun of our institutions of healthcare. And we would all like to keep schools open so our children can learn and thrive in person. And we would all like to see our businesses kept open and successful. So how do we do that? At the beginning of the summer, we were struck with the Delta virus that many thought at that time we had already passed the worst part of the pandemic. I wish we were past the worst part. Unfortunately, the Delta virus, as you all know by now, is a completely different beast. So much more infectious than the mother virus was. Unfortunately, Lake County residents were hit hard. Our hospitals were filled by the end of July, and they remain very, very busy. There is much that is not understood about the surge and the decline of COVID infections. We've seen across the globe that when it strikes, the infection rate goes through the roof, and then 2 to 3 months into the surge, a decline occurs. This was how it behaved where it first came out in India when they had their terrible surge last spring. The same occurred in the United Kingdom, and that is what we are witnessing in Lake County today. We had that surge, and the numbers are coming down. The surge is tapering off, but unfortunately in India and the United Kingdom, the number didn't return to the same low baseline that we had in April and May. And the question in my mind, is that going to happen in Lake County as well? Will we go back to the low infection rates we had in April and May? If we don't, that's really dangerous because we're likely to have other surges that will follow this, particularly with the holidays coming. This means that with all the hospitals working at maximum capacity now, we have few beds for those incoming patients. And this creates a huge problem. It means the routine emergencies that used to be absorbed into the hospital and cared for in an expeditious manner can no longer be cared for in that way. Many elective surgeries have had to be canceled. This is not unique to Lake County, but it's seen all over the country. When we were plagued with wildfires, we were told what we could do to curb the threat of losing our homes. Cut the grass, trim up your trees, clear 100 feet away. These preventive measures might save your sanctuary. Well, in the case of COVID-19, it's the unvaccinated population that is the human wood the virus can still burn through. And the unvaccinated are the main human reservoir in which the virus can propagate and spread. It's not the only reservoir. We are seeing that vaccinated people can be infected as well, but they rarely get severely ill and rarely require hospitalization. Greater than 90% of those hospitalized are not vaccinated, and greater than 90% of those who have experienced death were not vaccinated. Those that have been to the local EDs or have been hospitalized will tell you that the system is busting at the seams. I saw a recent letter written by the medical staff from Sutter Hospital in Lakeport pleading with all those to please go get vaccinated. I realize that most of you are young who may not get very sick, but some will die, as we have seen and will continue to see. An alarming trend seen across the country is that many children are also being hospitalized and that the number of child deaths is rising. This is probably because of the sheer volume of infections that we're seeing with the Delta virus and probably not the result of increased virulence. But as more and more children get sick, we will see some that do become critically ill and require hospitalization. This is why it is crucial that everyone in that reservoir get vaccinated for our children. I am a big supporter of keeping schools open for in-person learning. There's a mandate that all students must wear a mask while in school. I realize many are not happy with this mandate, but outbreaks in schools are not something that we can tolerate at our level of hospital occupancy. Such outbreaks would likely lead to the true rationing of healthcare, as we are seeing in different parts of the country right now in Idaho, Texas, Alabama, Mississippi, just to name a few. We haven't really discussed the quality of masking because masking in itself is very, very important, but the quality of masking is equally important. Not all masks are worn properly and not all properly worn masks provide the same protection. When the pandemic began, we encouraged all to use cloth or surgical masks and save the N95 or KN95 masks for the healthcare workers. We have overcome the shortage of the N95 mask, and they are readily available online and in many stores that sell healthcare supplies. A properly fitting mask that has two straps and seals around the mouth and nose will give you a much better protection than a surgical mask or a cloth mask. Any mask that does not cover the nose and mouth, I call these chin diapers, lend no protection. So I want to talk a little bit about what the health department is doing to fight the pandemic. As I mentioned, we have the mobile vaccination van. They vaccinated 138 people at the fair. We're looking to use the van to vaccinate at school sites, farm worker communities, and homebound patients. And I encourage all to please take advantage of this resource while we have it. Doing contact tracing, we're focusing on the skilled nursing facilities, schools, and shelters. We have 10 contact tracers. We still have too many cases to trace them all, and that's why we're focusing on the skilled nursing facilities, schools, and shelters. Overseeing testing, there's no longer testing being done by public health, but there are fixed sites and mobile sites that are working around 12 hours per day throughout the Lake region. As you probably are aware, we had an outbreak at the jail, I believe 76 cases, 13 of which are still active. It seems that that's coming under control. We can speak more about that if you wish. Epidemiology, as you saw the careful report that Sarah gave, we're collecting and analyzing the data to more accurately assess how to best proceed in our fight against the Delta virus. So in my full-time job as an ED doc, I ask most every patient I see if they have been vaccinated, and if they are not vaccinated, I ask them to explain why not. I have had many meaningful conversations as a result. Perhaps the most common reason I have heard is that people are busy with work, with family, and they haven't gotten around to it. People have to get around to it. It might be that they don't want to tell me why they haven't been vaccinated, but we've never had a vaccine that's safer than this one. We've never been more confident that promoting such a vaccine as these mRNA vaccines. There's been over 300 million of the vaccines given in this country, and not a single attributable death to the mRNA vaccines. If you are not vaccinated, please make an appointment with your primary care doctor to discuss the benefits of the vaccine. With the current surge with the Delta virus, all unvaccinated individuals are in grave danger of a serious infection. Although our numbers have dropped, the circulating level of COVID-19 Delta virus is still very, very high in our community. This is a smart virus that is looking for a host to infect. Just as forest fires look for wood to burn, the virus is always looking for a body to infect. With the levels of circulating virus, it will find you if you are in the community and not properly masked. Some people are holding off thinking that they will be covered by the herd immunity as we approach larger numbers of people being vaccinated. This was something spoke about early on in the pandemic, and we thought that if we could reach 80% vaccination rates, that we would have herd immunity. Unfortunately, with this virus, it's very unlikely to happen. In Israel, where over 80% of the people eligible for vaccine have got it, they are still seeing surges amongst the unvaccinated, and those surges are overwhelming their hospitals. The infectivity of the Delta virus is very high, and will find you if you're not protected by the vaccine. It may find you even if you are protected by the vaccine, but the likelihood of illness requiring hospitalization or leading to death is 10 times greater without the vaccine. I want to make a special plea to also protect some of the most vulnerable in our community: pregnant women, the elderly, and children. Throughout the state and nationally, we have seen a number of unvaccinated pregnant women become infected and ultimately die of COVID. Such a tragedy. Some of these women have had emergency C-sections before death to try to rescue their unborn babies. If you are pregnant and not yet vaccinated, please call your obstetrician or provider today to discuss vaccination. Vaccination is strongly recommended by the American College of Obstetrics and Gynecology during all trimesters of pregnancy. As Sarah mentioned, there's still a significant percent of people over 65 who have not been vaccinated. Regardless of how healthy you are in grave danger of risk of serious illness from the Delta virus. The majority of people who are dying are still elderly. Please make an appointment with your doctor to discuss how best to protect yourself. And finally, children. Many are asking how they can get permission for vaccinating their children under 12. Unfortunately, we don't have such a vaccine. Maybe by the end of the year we will. Although with the mother virus, we did not see many children infected. This is not the case with the Delta virus. As a result of the increased number of infections, we are seeing increased numbers of hospitalizations. In areas where vaccination percentages are low, we're seeing the ICUs for children overrun and overloaded with COVID patients. If you have children under 12 who have a chronic illness or are immunosuppressed, you should call your doctor and discuss with them how best to protect your child. If you restrict their world to interacting only with those who are vaccinated, they will be safer. They should wear well-fitting masks and preferably N95 masks. They should not be in school if there are active cases identified. When I leave this meeting, I will go back to the emergency department and continue to treat all those who present themselves. This message is to those who are not yet vaccinated. If you're a fence sitter and haven't yet decided what you want to do, please make an appointment with your doctor today to discuss it. It could save your life. If you're one of those who just won't consider a vaccine, I urge you to talk to those who have survived an ICU stay or to those that have lost a loved one. The process is absolutely awful, and the suffering goes on for days, weeks, and sometimes months. The virus starts with a sore throat or malaise. Then comes the headache and the fever, sometimes to 103 or 104. This is followed by severe fatigue and myalgias, vomiting, diarrhea. By day 7, you're coughing and starting to get short of breath. By day 9, you're gasping for air and making poor decisions because your oxygen level has dropped so much that your brain is not getting what it needs to think. Somewhere between day 10 to 12, you're so sick that you can't move, you can't eat, and you require everything to be done for you. Your respiratory rate is so fast you can't speak more than a few words at a time. We put you in the hospital, but you have to say goodbye to your family. You go on a ventilator to breathe for you. You're sedated such that you can't communicate with your loved ones. You're fed through IV lines and tubes, and other tubes control your elimination. In the best of hands in our county and the counties in the Bay Area, only about 25% survive on the ventilator. Your family suffers with you, fearing that you will not survive. Their fear is well-founded because this is all preventable if you're unvaccinated. So please, please vaccinate. I'm sorry to paint such a graphic picture of what it's like to be ill with this virus, but seeing it day in and day out, it's really difficult. So thank you for listening. A lot of the information that's being put out there by some of the people who spoke is exaggerated. And I just want to say that this isn't something that's being made up. You know, this is a pandemic like we've never seen before in our lifetimes that is threatening the whole world. It's not just Lake County. It's not just California, the United States. It's around the world. This isn't something that's made up. And if the people who are thinking that it's made up could experience what we see when we treat these people, you would understand that.